And Mix104.1 on the radio, the Mix104.1 app. Download for free, and you can listen on your phone. And, hey, get that local coronavirus update page as well. Just go to mymix1041.com. Our commitment to you is to provide you local coronavirus-related updates at the top and bottom of every hour here on Mix104.1. The next one in about 10 minutes. We're going to the phones now. Our volunteer Orthopaedics Mix line, and we say good morning to Dr. Todd Grebner of the Center for Sports Medicine. Good morning, Doc. How are you?
Fine, Steve. How are you doing today?
Well, we're doing good. Tell me how the Center for Sports Medicine has responded right now.
Well, I'll tell you, things are different, of course, with the virus going on, but we're holding up pretty well. We've really changed things. We're keeping up with all the CDC guidelines, but we're still open for business. We're doing a really extensive screening to get people into the building before they come into our office. There's a checklist and a temperature check, and we bring people back a little bit differently. We really limit the number of people in the waiting rooms, and just a lot of times people wait in the cars before they come out. But overall, we're still taking care of patients, and I'm just really proud how the community and the office staff have really worked together during this difficult time.
We're joined by Dr. Todd Grebner, of course, the Center for Sports Medicine. I guess especially in a medical office like the Center for Sports Medicine, this is a really big deal. Obviously, it's a big deal for everybody, but this does present some new challenges.
It really has. Our administration team, local community leaders, this is just taking a lot of planning, countless hours of meeting times on the Zoom apps now and different social distancing platforms. But, yeah, it really has just been really a groupthink type exercise going on. And even all the way down to the patients. The patients have been accepted of the changes that we're doing. A lot of new telemedicine now. This has really prompted, our group to offer telemedicine visits, and that's something that other groups across the country have kind of been prompted to use. But it allows patients to stay at home and still be seen, by the physician in a face-to-face internet-type viewing portal. It's really a game changer as far as keeping people safe.
We're joined by Dr. Todd Grebner with the Center for Sports Medicine, of course, here in Cleveland on North Ocoee Street. And I believe you, don't you have a clinic in Athens as well?
Yeah, there's a clinic in Athens as well. Right now, that's just kind of on a limited basis, maybe 1 or 2 half days. Currently a week. We've kind of pulled back resources a bit just with the safety issues. And, of course, the patients we're seeing right now are a little bit more acute, a little bit more in pain and more serious issues versus the chronic stuff. But, yeah, we do have an office in Athens, and that's been going probably for about 1.5 years to 2 years now.
Yeah. Well, Dr. Todd Grebner, Center for Sports Medicine, and talk about your team, talk about the staff there, and I know they're doing an excellent job.
Oh, they really have. I tell you, this virus updates, and it's changing, daily, if not hour by hour. So the guidelines have changed, but, all the staff from our cleaning crews to our CEO have just really embraced these changes just to keep people safe. But, everybody's still so overall just filled with spirit and smiling. And I tell you, one thing that I just hear all the time is just how wonderful our staff is, from the front desk to the therapy staff to everyone just really is just working together. And that goes not just with our staff. I also, of course, work at Tenova doing surgeries and taking care of inpatients. And I've seen that same kind of esprit de corps with the hospital staff as well as our clinic staff.
All right. Well, Dr. Todd Grebner, Center for Sports Medicine. Doctor, thank you very much for joining us this morning. We appreciate it. Stay safe, stay well.
You too. Well, thank you very much, Steve. Thank you.
All right,
thanks,
Doc.
Cleveland.
Thank you, sir, very much. All right, it is 7:25 coming up.